All right, today we're diving into a fascinating medical puzzle. How is it possible that two completely different lifestyles, one involving heavy drinking and the other, maybe a diet high in processed foods, can lead to the exact same serious damage to one of our most important organs? We're going to unpack how these two paths end up at one very dangerous destination, your liver.
So let me just ask you this straight up. What on earth could heavy drinking possibly have in common with something like obesity or type 2 diabetes? I mean, on the surface, they seem worlds apart, right? Well, it turns out they share a really surprising connection, and it all revolves around one of the hardest working organs in your body, the liver.
And the answer is, they can both push your liver down the very same dangerous path. This is the whole two paths, one destination idea we're talking about today. And for both of them, the journey starts at the exact same place, a condition that you've probably heard of called fatty liver disease.
Okay, so let's get into this common problem. For both of these pathways, the story doesn't start with a big, dramatic event. It starts quietly, with a silent buildup, a sign that the liver is getting seriously overworked and stressed out.
Now, this first stage has a technical name, steatosis. But all that really means is fatty liver. It's just a buildup of fat inside your liver cells. And here's the most important thing to know about this stage. The damage is often totally reversible. It's your liver's first warning sign, and it's a huge window of opportunity to make a change. So let's talk about path number one. This is the one that most people are probably familiar with when they think about liver damage. It's caused by drinking too much alcohol, and the condition is called alcoholic liver disease, or ALD for short. The way your body processes alcohol directly causes fat to build up in the liver, and that's what kicks this whole process off. And the progression from there follows a really clear and pretty damaging path. It all starts with that fatty liver, the steatosis we just talked about. But if the drinking continues, things can get worse. It can progress to alcoholic hepatitis, and that itis on the end means inflammation. The liver is now inflamed, and its cells are actually being damaged. From there, the final stop is cirrhosis, and that's the really bad one. It's severe, permanent scarring that basically stops the liver from doing its job. Okay, now for the second path. This one isn't driven by alcohol at all. It's all about our overall metabolic health. We call this one non-alcoholic fatty liver disease, or NAFLD. And here's something that might shock you. NAFLD has absolutely exploded in recent decades. So much so that it's now the most common cause of chronic liver disease in many Western countries. So what's driving all this NAFLD? Well, the risk factors are probably going to sound pretty familiar. We're talking about obesity, type 2 diabetes, high blood pressure, and high cholesterol. These things are so interconnected that doctors often refer to NAFLD as the liver's version of metabolic syndrome. And hey, does this progression look a little familiar? Yeah, it should. The progression of NAFLD is practically a mirror image of the alcoholic path. It starts with simple fatty liver, but then it can escalate to something called NASH. That stands for non-alcoholic steatohepatitis. This is the really dangerous turning point because, again, we see hepatitis, inflammation. It's not just fat anymore. The liver is actively inflamed and being attacked. And just like with alcohol, the final destination can be irreversible cirrhosis. One of the biggest challenges with both of these conditions is that they're silent killers. Most people have absolutely no symptoms until a lot of damage has already been done. So how in the world do doctors figure out which path a patient's liver is on? Well, a lot of the first clues show up in your blood work. Besides, asking about a patient's history, doctors look really closely at two liver enzymes, AST and ALT. And here's the cool part. In alcoholic liver disease, the AST number is usually higher than the ALT. But in the non-alcoholic version, that pattern flips. The ALT is usually higher than the AST. Just that simple ratio can give doctors a massive clue about what's really going on. And of course, it's not just blood tests. Doctors have a whole toolkit. An ultrasound can literally let them see the fat building up. A special kind of scan called elastography can measure how stiff the liver is, which is a good way to estimate scarring. And the gold standard, the way to know for sure what's happening and how bad it is a liver biopsy. All right, we've talked about the scary stuff. Now for the most important part of this whole story, the hope.
Because while that end stage, cirrhosis, is really grim, the progression of liver disease is not a one-way street. There are really powerful, effective ways to stop it in its tracks and even reverse the damage, especially if you catch it early. For the alcoholic path, the message couldn't be more direct or absolute. The medical evidence is overwhelming. For anyone with alcoholic liver disease, even people who have already reached cirrhosis, the single most important thing they can do to survive is to completely stop drinking, period.
And I mean, the data just speaks for itself. Look at this. For patients with alcoholic cirrhosis who keep drinking, their 5-year survival rate is about 60%. But for those who manage to stop completely, that rate skyrockets to 90%. That is a massive life or death difference, and it all comes down to that one powerful choice. Okay, so what about that metabolic path? Here, there isn't one single thing you can just stop doing. Instead, the most powerful medicine there is a change in lifestyle. This is really where patients can grab the steering wheel and take back control of their liver health. So, what's the goal? Well, researchers have actually found a key target. It turns out that losing just 7 to 9% of your total body weight can dramatically reduce not just the fat in your liver, but also the dangerous inflammation and cell injury that come with the more advanced NASH stage. So the game plan is pretty clear. Slow and steady weight loss, getting more physical activity, and paying attention to those other risk factors like blood pressure and cholesterol. And yeah, while there are some medications and even surgeries that can help in certain cases, the absolute foundation of managing NAFLD is and always will be lifestyle. So there you have it. We've followed two very different paths, one paved with alcohol, the other with metabolic stress, but they both lead to the same scary place. But the good news, the real story here, is that there are also two clear paths leading away from danger: abstinence and lifestyle change. The biggest takeaway is this: our livers have this truly remarkable, almost magical ability to heal themselves. The only question is, are we giving them the chance to do it?